Hello, everyone, and welcome to Arthritis Talks, the vital role of nutrition in arthritis management. I'm Dr. Sean Bevan, Chief Science Officer at Arthritis Society Canada, and as we wrap up Arthritis Awareness Month, thank you so much for joining us tonight. We've come together for this event from many different places. I would like to acknowledge the land on which I am located on and on which our Toronto office stands. And this is the traditional territories of the Mississauga of the Credit First Nation, Anishinaabeg, Huron-Wendat, and Haudenosaunee Indigenous peoples. Today, this meeting place is home to many First Nations, Inuit, and Métis peoples, and I'm grateful to have the opportunity to live with my family and work on this land. Now, more than 6 million Canadians live with a form of arthritis. And while there is no cure, we know there are many ways to manage it, including our diet. Proper nutrition can play an important role in helping those living with arthritis lead healthier lives. Now, before we get started, just a few logistics. First, this webinar is best viewed on a laptop or desktop computer. If you have any technical difficulties, please email arthritistalks@arthritis.ca for assistance. If you have a question for one of our presenters, you can submit it through the Q&A button at the bottom middle of the screen, and we'll try to get to as many questions as we possibly can during the time that we have together. You can also click on the chat icon in the bottom middle of the screen to access the chat and connect with other participants and our chat moderator. If you find that distracting, you can close out of the chat completely. Just click the red X icon to close out of the window. And finally, we are pleased to continue to provide captioning of our webinars to accommodate the diverse needs of our audience. So you'll see that running along the bottom of the page. Now, many questions we received in advance followed similar themes, so we'll address those first before going into a live Q&A at the end of the session. And before we get started, I have to thank our event partners, Pfizer, United Way Winnipeg, and others for their financial support of our Arthritis Talk series. Now, with that, let's get started, and a warm welcome to today's experts, rheumatologist Dr. Lihi Eder, who is joining us today from Ontario, and registered dietitian Arlaina Waisman, who is in British Columbia. So Arlaina, let's start with a question for you, please. First, is there a specific diet people living with arthritis should be following?
Okay, so before I answer that, I'd like to really address nutrition research that has gone on over the last century and really point out the fact that a lot of the research that's been done in the past didn't exactly get the messages right. So a lot of the studies were not well designed, not well controlled, and you got to really realize that when you're doing research on nutrition, that there's so many different factors to control for. So I think research has gotten better over time, much better, much more controlled, much better in terms of the outcomes and the messages that we get from the research. So keep that in mind. For years, we were recommending low-fat diets, and that wasn't necessarily the right direction to be pointing people in. So the research has come a long way since that time. And also something to keep in mind is that there are very strong food lobbies across North America that also had a hand in really messages along what to eat. They were influencing what went on, recommendations from various groups. So keep that in mind as well. So newer recommendations have been done primarily in conjunction with researchers who have reviewed the current research and come to their own conclusions. In terms of what to recommend for diet, we're clearly seeing with newer research that anti-inflammatory diets or anti-inflammatory food choices really make a difference in lowering inflammation in somebody's body. So I'm going to go into which foods to emphasize, which foods to minimize. And there's lots of different diets that are out there, and it can get confusing for people to know what to follow, what to believe. Uh, every year in the US, there is diet rankings. And if you Google 2023 diet rankings, you'll come up with this website, US News. They get together a team of experts from across the US, and these experts review the literature on the diets, rank the diets in terms of outcomes, and they summarize the pros and cons of every single diet that they review. And there's about 35 diets on there. It's wonderful reading. If you want more information about any of the diets, I would recommend taking a look there. There's links to other sites. It gets into more details about what to know about the individual diets. For the last few years, the Mediterranean diet and the DASH diet are the top ranking diets in terms of overall general benefits and also for anti-inflammatory diets, closely followed by the flexitarian diet and the MIND diet. And the MIND diet's claim to fame is also focused on cognitive decline, so minimizing that from occurring. So we want to age well, we want to retain our mental functioning. So great reading. Please check out the diet rankings. So what to eat in terms of anti-inflammatory foods, vegetables, and fruit at most meals, especially vegetables. In terms of fruit, emphasizing berries and oranges, those are great choices. More plant-based proteins. So the focus and the push is really emphasizing less meat in the diet, a little bit of fatty fish, and more plant-based alternatives. Emphasizing good fats, extra virgin olive oil. Everyone always asks, what's EVOO? Make that part of your vocabulary. Extra virgin olive oil, a good fat. If you need something with a higher smoke temperature, avocado oil is a good choice. And then there's the nut and seed oils. There's a variety of good oils. Emphasizing polyunsaturated. Lower fat dairy, especially yogurt, should be part of somebody's diet. Whole grains, good choices, high fiber, herbs and spices. These are all good things to be including in your diet as long as you tolerate them. If you have kidney disease, you might need something a little more customized for you. So always ask your healthcare team if things need to be tweaked a little bit. In terms of what to limit, nobody ever wants to hear this. What to limit? And these are abundant in the environment. So large quantities of meat and poultry, so less animal protein. High-fat dairy, especially those nice gooey cheeses that a lot of people love, not the best choice. Cream, butter, high-fat yogurts and yogurt drinks, hard margarines, lard, highly processed foods, packaged foods that are low in fiber and considered refined, where they had all the good stuff stripped out. Processed meats, sugar, and foods and beverages that have a lot of sugar added to them. Deep fried foods. These are all considered pro-inflammatory foods. So how much are you currently consuming? Can you eat less? Can you get them wiped out of your diet? That's really, things to think about. Where are you starting? What do you need to change? This is a great one-pager that came out from Harvard Public Health a few years ago that summarizes the foods to emphasize, really being anti-inflammatory, tomatoes, fruits, especially berries and oranges, nuts, especially almonds and walnuts, but all nuts are good. A handful a day is a great thing to be doing if you're not allergic to them. Olive oil, leafy greens, fatty fish are great choices. Foods to, again, reiterate, fried foods, sodas, refined carbohydrates, those are low fiber choices, lard and processed meats. Oops, wrong clicker. So these recommendations have been provided in a variety of formats over the years. In the US, they have traditionally had this pyramid. We had the rainbow. The rainbow has now been replaced with the healthy plate. I'll show that to you in a minute. But I put this up here, same recommendations you can see, and you can see it in a slightly different format. So I'm going to leave this. I'm not going to go into too much detail because I'll run over time. But this was adapted a couple years ago for rheumatoid arthritis. And you can see that it's very similar with a few caveats. So the majority of your diet, if you look down at the bottom of the pyramid, vegetables should be on every plate. So how much do you consume in terms of vegetables and fruit, grains, whole grains, high fiber, and you'll see on there, gluten-free for some people is recommended, not for everyone. Okay, so also things to consider: extra virgin olive oil, nuts and seeds, a little bit of red wine. And our alcohol guidelines in Canada have recently been revised. So we used to be saying from the 2012 guidelines on alcohol, 1 or 2 drinks a day isn't a bad idea. And now that has been revamped to be less, to 2 drinks a week. So something to think about in terms of lowering risk of other health issues. You'll see that there's some anti-inflammatory herbs and spices on there. A lot of recognition is being given to herbs and spices, especially the ones that are being studied and noted for their anti-inflammatory properties, like turmeric and ginger and cinnamon. The list goes on. Incorporate them into beverages, incorporate them into your cooking. Supplements have their risks and benefits as well, so I can touch on that a little bit later. You'll notice a little bit of chocolate is on there as well. So sweets can be incorporated wisely. High cocoa chocolate is something that has a lot of benefits. So if you like chocolate, the 70% or higher is where I would steer you. The higher the percentage of chocolate or cacao in there, usually the less sugar is in that product. So that's a good thing as well. This is the new Canada's Food Guide. It's another way of saying all these same recommendations, but an easier way of visualizing what are you eating for every meal. So in terms of the healthy plate, compare your breakfast, lunch, and dinner. Is half of your meal made up of vegetables and fruit, a quarter with some protein, a quarter with some whole grains, basically, and water is the fluid of choice. And I know people are drinking a lot of different choices besides water. So what are you drinking and how does it stack up? In addition to what you're putting on your plate, consider how you're actually eating. So the recommendations are paying attention to what goes on. Are you mindful of your eating habits? How long does it take you to eat a meal? Are you cooking? Are you going out? Are you ordering in? Are you enjoying your food? Are you eating with others? These are all things that really contribute to the eating experience. And I encourage you to reflect on what goes on for you. In terms of these anti-inflammatory choices that I've mentioned, they're not just good for managing arthritis. They're good for managing most chronic conditions. So anti-inflammatory choices are being recommended for metabolic syndrome, heart disease, high blood pressure, also known as hypertension, diabetes, many forms of cancer as well. And Dr. Eder will also talk about when we see people with more than one condition, how weight is also involved in carrying extra weight, specifically extra fat on one's body, how that comes into play and contributes to how well someone manages disease. When it comes to omega-3 supplements, there's been a bit of a flip-flop on, should everybody be running out there and buying supplements? For a while there, it seemed like everyone who came to my classes was taking omega-3 supplements. And the research really doesn't support that it does a lot for everyone. The recommendation around omega-3s, try and get more through your food choices. There's lots of foods high in omega-3s. Consume those regularly. So get your extra virgin olive oil, get your nuts, get your seeds, get your fatty fish. Those are great ways to get omega-3s through the diet. If you are supplementing with omega-3 supplements, discuss it with your doctor in terms of how much is right for you. There has been some recent research that shows that if you already have elevated blood fats or blood lipids, that you might need to be careful with omega-3 supplements, that there has been an association with developing atrial fibrillation, which is a heart rate, basically an unstable heart rate. You don't really want to have that. And so you need to discuss that with your physician as far as quantities. So I do mindful eating classes through Oasis, and I can tell you that a lot of people that come to those classes eat too fast. It's just a thing. So if you're a fast eater, I want you to reflect on that. Can you slow down? Put the utensil down between bites. Chew your food. Take at least 20 to 30 minutes to eat a meal. So chewing slower, taking the time to eat a meal really puts people better in touch with hunger and fullness cues. I want you to be in touch with hunger and fullness cues. There's a lag between our brains and our stomachs in terms of fullness. So eating slower allows your brain to catch up with, are you satisfied? Have you had enough to eat? That can make a big difference. In terms of intermittent fasting, this is something that's gaining a lot of traction. A lot of people ask questions about it, and there's a lot of research on intermittent fasting. There are different ways of doing intermittent fasting. Some people say, I don't eat for 1 or 2 days a week. I just have something to drink. Now, that's definitely not going to work for everyone. And especially when you have arthritis, and if you suffer from fatigue, how are you going to feel not eating for a whole day or for 2 whole days? So I want you to take that into consideration. A lot of people like the time restricted eating. So some will do as short a time as 8 hours. Some will do a 10 to 14 hour period of time for the day that they decide this is when I start eating and this is when I end eating. And the research does show that if you do that and you do it earlier in the day rather than too close to bedtime, that quite often it does have benefits for people. Some people might lose weight, not everybody, because choices still do matter, but that a lot of people actually see a reduction in those inflammatory markers. So it's worth trying, especially if, certain markers like CRP is running high. Maybe you're eating too close to bedtime, or for those people that eat too close to bedtime or maybe get up in the middle of the night to have a snack, this might be a better way of eating. Eat within 1 to 2 hours of getting up in the morning, and then can you get all your eating for the day in within a 10, 12-hour period of time? Something to think about. Okay, I think I'm done for now.
Well, thank you so much, Arlaina. I am going to go to Dr. Eder in one moment, but we have had so many people ask this question that I would like to ask you now, if that's okay. And that's really about nightshades. And I don't think you mentioned it explicitly. And you did have tomatoes on one of your slides, and there are lots of people asking about tomatoes, whether they're good or bad. So if I could just take a moment to turn it back to you to address that.
Okay. So when it comes to nightshade vegetables, this is something that it was proposed a number of years ago by a researcher whose name was Norman Childers. He said, if you take nightshade vegetables out of your diet, your osteoarthritis will go away. The main nightshade vegetables that we're talking about are tomatoes, potatoes, eggplant, and peppers. So there have been numerous studies done over the years to try and either back up his findings or negate his findings. And many of these really well-controlled, well-designed studies didn't come to the same conclusions. So you can eat these foods. However, some people do have a sensitivity to solanine, which is a compound in this family of food, the nightshades, the Solanaceae family, and they might be able to tolerate a small amount, but when they eat a larger amount, all of a sudden, they don't feel so good. And some of the symptoms tend to be feeling generally unwell, joint pain, and sometimes it's hard to sift out, is this a flare of my arthritis, or do I have a problem with nightshade vegetables? So, I always recommend to people, cut them out for a month if you have a problem with them, and then reintroduce them one at a time and see how you're feeling.
Okay, thank you so much, Arlaina. Now, Dr. Eder, let's turn it over to you. We've had several questions about people's weight and how that might affect their arthritis. So could you elaborate, please, a bit?
Thank you so much. So Arlaina has given us a really nice overview and recommendations regarding nutrition. And I will talk, obviously, nutrition is very much associated with this extra weight that many of the patients that I see in my clinic are struggling with. So we actually have made some progress in terms of research and trying to understand the relationship between overweight and arthritis in general. And there is a strong link between overweight and the risk of developing some types of arthritis. In particular, a very strong association has been found between certain types of arthritis, including psoriatic arthritis, osteoarthritis, and gout. And these are conditions that people that are struggling with overweight are at a higher risk of developing. Rheumatoid arthritis, which is a very common type of arthritis, is also associated with overweight, but to a lesser extent. Now, overweight, as many of the listeners I'm sure know, is also associated with many other conditions that can complicate the treatment of arthritis. So having overweight is associated with metabolic syndrome, which is the condition that includes diseases like diabetes, high blood pressure, high cholesterol. And these conditions increase the risk of developing heart conditions like stroke and heart attacks. And overweight is also associated with increasing pain disorders, so higher levels of pain and mood disorders like depression. So when a person that is living with arthritis also is struggling with extra weight, there is a tendency to have multiple conditions accumulate at the same time, and this can complicate treatment and makes the treatment of arthritis a lot more complex. I'll try to give you a few examples why it is more complicated. So I mentioned having pain as a problem. So having higher weight is associated with higher levels of pain and more disability. But surprisingly, this has not been associated with a higher risk of developing more joint damage as a result of the arthritis. So there is this disconnect between the level of inflammation and the level of pain, and this can complicate our assessment as rheumatologists. In addition, some of the inflammatory markers that we evaluate as rheumatologists, and in particular, I'm talking about CRP, which is this blood test that we use to accurately assess the level of inflammation. It tends to be higher in people that have overweight, and this is because this protein is being produced in the adipose tissue. So then it can falsely be elevated, even though the inflammation is actually under control. So, you may see that your blood test is showing these red marks, but the rheumatologist may tell you, oh, I think your arthritis is actually under control, and that's because this protein is being produced elsewhere and not in the joint. And finally, evaluating whether there is active inflammation in the joint is very much relying on physical examination. So as you, I'm sure, know, rheumatologist is palpating the joint and is trying to see whether the joint is swollen or not, and that's a way for us to assess whether the disease is active. And when there is this extra tissue on top of the joint, it's getting quite complex. And in these situations, the rheumatologist may need to use some imaging modalities like ultrasound, CT, MRI to get a better sense and better picture of what is actually happening in the joint. So there's been quite a lot of studies looking at overweight and it's associated with disease activity. And this is a study that we've conducted in Toronto, in the Toronto Psoriatic Arthritis Cohort. We evaluated over 500 people living with psoriatic arthritis over time. And we assessed what is the association between their BMI and their chances of reaching a minimal disease activity state. So a minimal disease activity state is a state that we aim to reach in treatment. And that means that the level of pain is very low, that there are no swollen joints and no tender joints, and overall the condition is under control. What we found that people that have higher BMI have lower chances of actually meeting these targets. So it means that it's harder, even with medications, to get to these levels. And with a BMI of more than 30, which is considered to be obesity, the chances are about 50% lower to reach these targets. And we also have more studies looking at the effect of overweight and obesity on biologic treatments, and biologic treatments have changed the art field in rheumatology and being very effective in preventing joint damage from happening and improving people's life and improving their symptoms. But unfortunately, having higher weight is associated with lower response to treatment. And this is an example of a summary of multiple studies looking across different types of arthritis, showing that obesity is associated with 60% higher risk of treatment failure, meaning that patients started the treatment but had to discontinue. Most of the time, this was because this treatment was less effective or not effective. And there was a dose-response association, meaning that the higher the BMI, the lower the chances are to achieve this target. We don't entirely understand what is the mechanism behind that. So there may be that the adipose tissue, the extra adipose tissue, is producing more inflammatory factors. So it actually acts like an organ that is producing proteins that are similar to the proteins that are causing inflammation and are produced in the joints, and there the medication is just not enough to control the overall inflammation. So in these situations, sometimes higher dose or trying a higher dose of the biologic therapy might work, and especially this could work if there was an initial response, and instead of getting to the lower disease activity state or to a remission, then a patient is improving by only 50%. So in this situation, the rheumatologist may consider increasing the dose or reducing the interval between the injections. So lastly, I just wanted to mention, this is a summary of the principles of management of overweight and obesity. This is from a recent Canadian guidelines. And I think, I guess this slide is, the key message of this slide is that management of overweight and obesity is something that requires multidisciplinary care. So it's very, very hard to lose weight and to achieve healthy weight alone. And overweight and obesity are not lifestyle choices, okay? So it requires advice and help from professionals. And there are some changes in nutrition that, as Alina just described very nicely. So these things, being evaluated by a medical nutritionist or dietitian is really key, because each one of us is different and has their own preferences and their own lifestyle. And so getting this personalized counseling is really key. The second key principle is exercises, and exercises is particularly challenging for people living with arthritis because the joints are painful. So this is where consulting with a rheumatologist about ways to control pain, and sometimes what I advise my patient is, having this manage the pain prior to starting exercising will allow people to do more and to actually get into the routine of doing regular exercises. But this is certainly something that needs some discussion with the treating rheumatologist. And then beyond that, there are several other options that depend on the level, the severity of the BMI and any other medical conditions that exist. But basically they range from behavioral therapy, which is could be either meeting with a psychologist or group therapy like Weight Watchers, to get into the routine of changing behaviors and getting that change in nutrition and exercise into the routine and in daily life. I'm sure many of you have heard about the new medications that were approved for weight loss, and these are certainly available, and they need to be prescribed and discussed with a family physician or through weight loss programs. And the more, I guess, drastic or radical option is bariatric surgery, and this is generally reserved for people with higher BMI or people that failed other options. So I think these are really key, and the key message is it's hard to do it alone. It requires multidisciplinary care and approach and consulting with specialists.
Hey, thank you so much, Dr. Eder. Arlaina, one of the challenges that we know that many people face, especially when we think about today's rising food costs, is really the cost related to eating healthy. So do you have any recommendations for people who are trying to eat healthy but realistically are on a budget?
Yeah, okay. So meat tends to be the most expensive part of people's food budget. So if you're choosing more alternatives in terms of plant-based proteins, they tend to be more economical. So look at how many meals a week are made up of meat, or can you maybe extend some of those meals by adding beans, cooking a stew, putting beans in instead. So definitely plant-based proteins. Take advantage of foods that are in season. When foods are in season, they tend to cost less. Check flyers. Take advantage of specials. Know where to look in the grocery store. So things that are at eye level tend to be more expensive, believe it or not. Manufacturers pay more for prime shelf space. So look up, look down. Quite often, some of the better buys are where it's hard to reach, where you have to actually bend down or get up high. Those tend to be good places to look. I like, there's an app that I have on my phone called Flip. It's really good. So how it works is you enter your postal code and say you're looking for organic strawberries. So what the app does is compare organic strawberries at local supermarkets that are close to you. And it'll compare the prices and let you know where it's most affordable. So you can take advantage of, price matching. And some places will price match. So if you show them the price, this is available for this price at somewhere else, you can do all your shopping at the store of your preference. Don't tell them I sent you. And then there's things like the Inflation Cookbook, which it's an online resource that you can use, and it will give you recipes of items that are less expensive and show you how to use them in a recipe. Also, don't forget, there's a couple of resources that I always refer people to. Cookspiration and eatingwell.com are great websites for recipes. And you can actually enter in budget as a search. And you'll get lots of information on less expensive recipes that use less expensive ingredients. On Eating Well, there's even, if you put in Mediterranean diet and budget, you'll get a whole variety of recipes and information for you to customize and make recipes using ingredients that you like. Because let's face it, not everybody likes to eat the same foods. Okay, so you need to make it something you're going to enjoy. How to really stretch your dollar a little bit more. So those are some good resources to know about, and then it's up to you. Shop wisely. There are also challenges that I want you to think about, because situation specific, it's not always easy to make the healthy choice the easy choice. We get influenced by others. Who are you eating with? Are they making the same choices food-wise? Are you influenced by your friends and family? Do they push you towards dessert? Is it an every evening event? Or are you making different choices? How does marketing and food availability influence your eating? When you see someone walking down the street with a cup of something and you know where they've gotten it, do you all of a sudden decide you want something to drink? And do you find yourself walking over there? So again, marketing, food availability, the environment, food is everywhere. We get messages throughout the day. What ends up affecting what goes on for you? Cost comes into the picture. I would far rather you spend money on food choices than on supplements. I haven't really talked about supplements, but I would really encourage you to consider, with the rising cost of food, not everybody has the luxury of spending their money on expensive supplements that haven't necessarily been shown to make a big difference. I would far rather you get them through good food choices. Okay. Energy comes into the picture. You know, if you're got a flare of your arthritis, do you feel like cooking? What ends up happening for you? So think about, do you need to have things pre-prepared? Do you need to have backup supply of healthy choices in the freezer for when you're not feeling well? What will allow you to still eat healthy? Okay. And hopefully we'll talk about that more during the question period.
Yeah, those are great suggestions, Arlaina. Before we do get into that question period, Dr. Eder, I was just wondering if you could touch a little bit on what some of the current research is related to arthritis and nutrition. And Dr. Eder, I think you might still be on mute.
I am, now I'm not. Okay.
There we go.
So thank you. So I'm going to give a brief update on what is actually happening in research. And I know that many of my patients are Googling about diet and arthritis, and there is a lot of stuff in the internet. But many of these advices are really not based on good science. And I also put a picture of Kim Kardashian because she does have psoriasis and also psoriatic arthritis, and she gave some diet recommendations that, again, I'm not sure that are really based on much science. So let me just go through some of the data that we know. There are lots of questions about what types of diets and what kind of supplements, and Mediterranean diet was mentioned by Arlaina, and I think this is really the type of diet that we have most data on. And most of these studies were observational studies, but there has been also a few randomized controlled trials where people with arthritis were randomized to a Mediterranean diet or to a control group. And overall, most of the data that we have is on this type of diet that is rich in fruits and vegetables and olive oils and nuts. I brought this study because I think it's an overall a good study that evaluated 120 patients with rheumatoid arthritis. This is from Portugal. They were able to show that people that adhered with this type of diet had 70% less activity of the rheumatoid arthritis. There was also less physical dysfunction, which they were able to function better or have the less impact of their arthritis on their quality of life and daily function. And they overall also looked at the inflammatory diet in general, and this is another questionnaire, but it seems like the Mediterranean diet had the greatest effect on rheumatoid. And what do we know about psoriatic arthritis? So this is another major type of arthritis. Here we have even less data, and the really only good study that we have, or only randomized trial that we have, is focused more on weight loss rather than on specific food choices. But this particular one looked at patients with active disease that were starting treatment with biologic therapy. These were TNF inhibitors. And they show that by trying a low-caloric diet, so the goal was to lose weight versus a comparator arm, these patients were able, much higher chances of achieving a minimal disease activity state. And there was being a dose-response association between the BMI and the chances. So the greater amount of weight they were able to lose, they had better chances of achieving this target. So the association between overweight and psoriatic arthritis activity seemed to be quite strong. And I brought this because these are the guidelines from the American College of Rheumatology that were published just last year. And these are based on existing data. So these are based on science, and they had 3 recommendations concerning diet. But you may notice there that if we look at the column there that is so that is titled as certainty of evidence, it really is ranging from low, very low to moderate. So it means that there is really not a lot of studies, and the quality of these studies is not the greatest because there were relatively few patients, or there were some problems with the design of the study. But nevertheless, I'll just go over these recommendations. So really the only recommendation that is stated here is that Mediterranean style diet is conditionally recommended for patients with rheumatoid arthritis because we have most data on, and even that the level is low to moderate, but still means that if you have to choose one diet, Mediterranean style diet seems to be the one that has the most data to support that it can benefit arthritis. And there is certainly quite a lot of data to support that Mediterranean diet is good for general health, for reducing cardiovascular events, and to even reduce risk of premature death. And if we look at other types of diet, they generally recommend against adhering with any other formal type of diet simply because not that it doesn't work, because there is really no data to support that any particular type of diet, whether it's a keto diet or any other type of diet, is beneficial for arthritis in particular. Remember that they are looking only at arthritis, whether these types of diet has any science to support that they improve arthritis. There is really none. And finally, as Elena mentioned, supplements, there is really no studies that support that any particular supplement could benefit arthritis in general. So as mentioned, if you need to invest money, then it's probably better to invest in healthy food choices rather than in purchasing any supplements specifically for arthritis. I should mention, though, that if you need to take supplements like vitamin D or iron for other medical conditions, of course, this needs to be taken, but specifically for arthritis, there is no evidence to support that any vitamins or any supplements benefit arthritis. So I wanted to touch a little bit more about Mediterranean diet, because this is a diet that we are currently investigating as a way to combine with medications to improve control of psoriatic arthritis. And I mentioned that Mediterranean diet is beneficial because it has monounsaturated fats that are in the olive oil and polyphenols that are in fruits and vegetables, and many other components that have been shown to be beneficial for the heart and to reduce chances of developing cancer and other degenerative diseases in the general population. This type of diet may also be associated with some mild weight loss, and so that's also a generally good thing. But there is very little data on psoriatic arthritis in general. I'm studying this condition, and I'm particularly interested in trying to improve control of symptoms, because many patients that I see in clinic, even though they are very strong biologic therapies, they keep having fatigue and stiffness and pain in the joints, even though that I cannot detect any evidence of activity. So this is really an exciting study that we are currently holding in Toronto. We are studying whether different dietary modifications could help improve control of psoriatic arthritis, in addition to beyond the medications. So we are enrolling people that have overweight and are on stable treatment. We are randomizing them to one of 3 arms. Each arm receive different modifications of diet, and this is based on meeting with a dietitian that is planning and advising regarding these dietary changes. It's a 6 months program, and we do hope that at the end of this process, we will know more about what kind of diets we could recommend to our patients. We had a chance to analyze some of the data, and this is based on what people report when they started the study. We found that people that had or adhered with recommendations of sugar and fruit consumption, these people tended to have lower levels of pain and less fatigue and less disease activity. So again, suggesting that food choices and diets could have an important impact on disease activity. And I just put it here because this study is still open. So if anyone is interested in learning more, feel free to look at this website. I believe this is also posted in the Arthritis Society website. So if anyone is interested in learning more details and whether they can take part, feel free to reach us.
Wonderful. So thank you both for all of that information and sharing all of your expertise with us tonight. We have received many, many questions about specific types of food or specific types of diet that we have many resources on our website at arthritis.ca about. So we will certainly send you all that information. If not tomorrow, the next day, you'll have that in your inbox. I just want to take advantage of the last few minutes we have with our experts today to ask some specific questions about their particular areas. So first, maybe for you, Dr. Eder, questions here about, you talked about the impact of people being overweight. Do we know anything about people who have low BMIs or who are underweight in that context?
That's a very good question. So typically in rheumatoid arthritis, underweight has been an issue because when inflammation is very, very active, the body requires more energy, and that increased consumption can be associated with weight loss and lower weight. And certainly that can be an issue, and that can be an indicator that disease is active. And obviously it needs to be investigated with the rheumatologist. Underweight can also be associated with osteoporosis and higher risk of fracture that we know is a major morbidity in patients with arthritis, especially patients that are taking steroids. So again, underweight is also may not be a good thing and needs to be investigated and managed.
Okay, thank you. And maybe Dr. Eder, if I could also ask you, are there any particular foods that you would not recommend for people in terms of interacting with their arthritis medications?
So specifically with arthritis medications, I'm not aware of any type of foods that interact. And there are foods that interact with other medications. For example, people that are taking some blood thinners can interact with some foods, but these are, as a general rule, none of the medications that we use typically interact with certain food components.
Okay, thank you. Arlaina, we've had a few questions about probiotics and how they fit in. I just wondered whether you could spend a moment commenting on them in terms of people living with arthritis, whether they should be considering them in their diet carefully.
So there's been so much talk about pro and prebiotics lately. So really, I recommend, again, getting probiotics, healthy bacteria, good bacteria into your system through food choices when at all possible. So you can get it through yogurt drinks, with traditional, cow-based or soy-based or other milk alternative yogurts that are available today in terms of getting those probiotics. There's kefir, there's fermented foods. There's all sorts of ways of getting probiotics into your system. Miso, the list goes on. And for those probiotics to work well, it really helps to have prebiotics on board as well. So that means good high fiber choices that help your probiotics work better. So things like bananas and artichokes, Jerusalem artichokes, asparagus, foods that have inulin in them, that it's a supplement that's added to a lot of foods. It's made from chicory root, and it's a good way of getting extra fiber into different foods that have been traditionally low fiber choices. Inulin is being added to breads and cereals and yogurts and crackers, all kinds of choices, pastas, to make them high fiber. So a lot of people benefit from that. Some people don't do well with inulin, so that is something else that is good to know. So proceed with caution if you suffer from irritable bowel. But please do get more pre and probiotics through food sources. There's been some talk about whether or not you should take probiotics in supplement form, because they are not necessarily the best thing to be taking in supplement form if you do have arthritis.
Okay. Also, a few questions here about whether the recommendations that you gave, Arlaina, were applicable to all types of arthritis, or whether we know anything about particular foods and how they relate to particular types of arthritis.
I think the guidelines that I did go over are applicable to all types of arthritis. I think those are good guidelines for if you have diabetes as well, for anyone to be following, really, in terms of being just wise choices around food and eating. There are specific guidelines when it comes to gout, and you can find those in any number of places on the arthritis website. Those are available in terms of certain foods that you really should minimize. But definitely in terms of the guidelines I put out there, I think they're applicable to everyone, especially if you, I know there was some questions about if you have diabetes as well, how do those guidelines come into play? And they're applicable for people struggling with diabetes as well.
Wonderful. Arlaina, Dr. Eder, thank you both so much for sharing your knowledge with us today. We would like just to take a few moments to get the audience's feedback, if we could, on today's presentation. So for those of you who are watching on the Zoom call, you should see a poll question come up on your screen with some answer options. So click on the response that really does reflect your thoughts. I feel more knowledgeable and empowered after attending this webinar. We will also be sending you an evaluation form when we email the recording and the slides. So if you weren't able to access that poll question, please do give us your feedback at that time. We use this survey feedback to shape our future Arthritis Talks webinars, so we really, really do value your input. Once again, we are grateful to Pfizer, United Way Winnipeg, and our other financial partners for their support of this event. And as I mentioned earlier in the webinar, September is Arthritis Awareness Month, and throughout the month, we have been sharing real stories of Canadians living with arthritis, trying to shine a light on its prevalence and the serious impact it has on people's lives. So I really do encourage you to visit arthritis.ca to hear some more of those stories and learn about how you can help end the agony of arthritis. Also, join us next Wednesday for Arthritis Talks, Arthritis in the Hips. More information and a link to register will be included in an email to you tomorrow. So with that, this concludes tonight's Arthritis Talks. And on behalf of all of us, thank you so much for joining us, and please do stay well.